Okay, so this is a pose I created for someone who had surgery on her shoulder and had a lot of shoulder pain. They actually had to rearrange her bones and muscles, so there was something structurally that had been altered that we couldn't address that, but she had so much pain, so I thought, well, how can we at least optimize the action, even if we can't change the position of the bones and muscles that were altered surgically, but at least we can, perhaps start to make some changes that will, and within one session she was cleared of pain. It was pretty incredible. She was pretty amazed because she'd had pain for years since the surgery. So I created this for her. It's kind of like a fish pose, but we took it to the wall. So we have to start from the foundation. So we make sure the feet are parallel. And we establish Tadasana. Make sure everything is aligned as usual. So we lift the toes, we lift the arches, we can hug the shins, micro-bend the knees a little bit, move the thighs in, back, and apart, gently scoop the tailbone down, breathe into the back body at the kidney area, beautiful, and then maintain that as you exhale. Inhale, lengthen the side body, establish a beautiful inner light of the heart, move the arm bones back, and then you can externally rotate the upper arms. You can just sort of turn out like that. Yeah, and then try to keep the external and then just turn from the elbow down, just kind of like facing in like that. Yeah. And then press the head back. Okay, now you can actually press your head. I'll just move your little ponytail a little bit. Move it up a bit. Just pull it. Pull it. Okay, yeah. Okay, so now you can get your head on the wall and keep, now only your elbows and head are touching, because now you're going to start to walk your feet away and you want to maintain that relationship. So everything has to incline equally, so your upper back will come off the wall and you don't want to have wrinkles in the front or the back of the neck. Okay, perfect. So you can stay there. We can add a block between the shins to make that more stable in the foundation. Now, if you take your elbows off just a millimeter, see, if you're just pressing only with the head, you're going to get the muscles that are along the vertical length of the spine. And if you just press with the elbows more and less with the head, you get the horizontal muscles through the rhomboids and across this way. So you're literally that cross that we talked about at the heart, you're strengthening the length and the horizontal right in the back of the heart. So you want to do both, the length and what's going to help to hug the shoulder blades back. Now, as you take a few breaths here, what I can do is I can look from here and then just make sure, is her side body equally lengthened? We're going to just slide your head this way a little bit to bring you more in line with your hips. Perfect. Now, if that's easy for them and they can breathe and hold their neutral spine really well, then we can go to the next step, which is pressing the pinky side of the hand into the wall and walk your feet a little, just kind of shimmy your feet a little bit. And then press so much that your elbows and everything come off except for your hands. And then you can even shimmy your feet a little bit more if you have it. So the more you get on that incline, the more you're working against gravity. And then you just think of lifting the heart, even though we're going to exaggerate this a little bit because it's going to help to reduce the kyphosis. You have to exaggerate this a little bit and maintain. And so again, you're pressing with your hands, which is going to work across the back, and then pressing with your head, which is going to work the length of the back. And then once you're done, you can just back up your feet again and then just come into natural standing. Come really slowly out of it so you don't like quickly undo the pattern. You allow the pattern to slowly come into, just standing, and then just step away from the wall a tiny bit. And when you stand, you can feel how your whole posture is transformed. It's really amazing.
I feel like I'm...
Yeah. So because you've exaggerated this so much, because when we're standing, we're often doing everything in front of us, so these muscles get shorter and tighter, and then the back muscles get weaker and lengthened. So we're actually doing the opposite. We're trying to stretch this open and strengthen and shorten through the back, which is, the pendulum goes this way all through the day. So we're going to bring the pendulum a little bit this way to try to find the balance. And then when you come off the wall, you feel really, really good. So check that out.